Hello everyone, welcome back to my YouTube channel Speedy Dentistry. Today we'll be learning about the parotid gland anatomy. So basically it is the largest salivary gland with a weight of 15 grams. Alright, the parotid stands for the para, that is around, otid is for ear. So this gland will be present around the ear. Coming to the borders and surfaces, so basically if we stimulate it as a triangle, so there will be lateral, this is the medial side, anterior and posterior. And for the surfaces, this surface will be superficial, this will be medioposterior, and this will be anteromedial surface. Moving forward to the arterial supply. The arterial supply will go upward, that is from the external carotid artery and then posterior auricular artery. It will move upwards to the maxillary artery, transverse facial artery, and the terminal branch, superficial temporal artery. Venous drainage will be there as it will be coming downwards. So for the venous drainage, we have superficial temporal, same transverse facial, maxillary, and they will come and retromandibular vein. So this will be retromandibular vein. Posteriorly we'll be having posterior auricular and external jugular vein. So both of them will form the posterior division. Anteriorly we'll be having facial vein and common facial vein. For the nerve supply, the motor nerve supply comes from the facial nerve, sensory comes from the auriculotemporal nerve, that is auriculotemporal nerve, which is affected in Fraze syndrome. Fraze syndrome video in detail is already posted on my channel. For the sympathetic supply, it will be plexus around the middle meningeal artery. Alright, for the parasympathetic pathway, it will be inferior salivatory nucleus, glossopharyngeal, then comes the tympanic plexus. This is the path, tympanic plexus, I, GT, low, PAP. L will stand for lesser petrosal, otic ganglion, postganglionic parasympathetic fibers, auriculotemporal nerve, and then the parotid gland. Coming to the parotid gland in detail. So parotid duct will be of approximately 5 centimeter and it will open around the second molar, that is the maxillary molar. And in case of deciduous, it will open around approximately at the site of first deciduous maxillary molar. Coming to the detailed anatomy of the gland. So here we will be having, this one is the skin, then this is superficial fascia and deep cervical fascia. This is pharynx, both the extremes, that is the lateral and medial surfaces we have drawn. Then the upper will be anterior and lower posterior surface. For the bone part, this is mandible and this is mastoid. So mastoid and this is mandible. On the mandible, lateral side masseter, outwards masseter will be present, and on medial side, medial pterygoid will be there. For the mastoid, the outer will be formed by sternocleidomastoid and medially it will be the posterior belly of digastric. Now coming, this will be the bony and muscle structure. Also there will be styloid process. You have to remember this anatomy because the part to identify the facial nerve will be depending upon the parotid gland anatomy only. So styloid process, then we are having the muscles which form the mnemonic HGP. And in front we'll add stylo. So stylohyoid, styloglossus, and stylopharyngeal. For the arterial, venous, and nerve supply, so this is carotid sheath. In this, here will be internal carotid artery, internal jugular vein, and 10th cranial nerve, that is vagus. Inside the parotid, this is the facial nerve, retromandibular vein, because since it is behind the mandible. and anteriorly we'll be having external carotid artery. So this parotid gland anatomy will help us to identify the facial nerve, and various methods are there to identify the facial nerve, which I'll be discussing in the next video. Thank you and stay tuned for more.